Could you introduce yourself, please?
I'm Esofa Piggott. I'm a registered nurse, midwife, emergency medical responder, spirometry technician as medicator attached to the Georgetown Hospital Corporation.
Explain to me what that technician term is that you just mentioned.
Okay, so the spirometry technician, that's basically a asthma specialist for a nurse who basically do stuff like lung function testing and management and care for asthma COPD patients.
So you work in the COVID-19 unit?
Yes, so I'm currently working in the COVID-19 unit. I'm actually the head nurse on the floor, managing the nurses attached to that department as we stand.
Is that a job that you took on willingly?
So, yes, I am the most senior nurse on the floor right now, so it actually came with the territory. So, yes, it is.
It's a challenge for a person like you to work in a unit like that, not knowing everything that we should know about COVID-19?
I would say yes, it is challenging. I would not try to polish it up in any ways because I am a family man. I have a wife at home. I have 2 kids at home, one being only 3 months old. So for me, leaving my home, having not to be home or literally not being home right now, and yes, walking into an infectious unit like that, not knowing or not understanding everything that goes with it, it is challenging. Day by day, myself, my staff, even the doctors I know, we worry, especially concern our health and our family's health.
How are you able to protect yourself?
Also, in protecting ourselves, I would say the management of GPHC and with some assistance of the Ministry of Health, they've provided us with all the necessary requisites that we need to keep ourselves basically intact or to prevent us from basically attracting the COVID-19.
Give me an idea of what some of those things are.
So some of the things, we have the complete PPE suits, which is the personal protective equipment. So it basically covers you from head to toe. So it would be those same pictures that we would see when around from Italy, from France, Spain, all over the world. So we do have those suits here to protect us all.
Right, and so you feel safe?
So yes, we do feel safe. So I would say yes, we feel safe to an extent, but like I said before, it's still not fully understand.
Right, and how many nurses do you have working with you?
On my staff complement, at the moment, I have 12 nurses working various shifts to cover, including day offs and every single thing at the moment. And that's just to go with the current workload that we have. But God forbid that things get worse, I will need more nurses on board.
And the hospital has that capacity?
So yes, the hospital has the capacity of nurses, but fully to volunteer for something like that, it's very difficult because we need to understand that yes, we're nurses. Some persons are pointing out that you guys are heroes and this kind of stuff, but at the end of the day, like I said, for myself, and I know for many others, they have their families and so forth to go back home to also. So it's a choice between either you helping in that department or you help in another way in which you can help. Maybe you go at the gate and you help, where we also need persons there. Or you go on the regular open wards because we still have regular patients that are coming to the hospital that are not COVID-19 patients that still need care and attention also.
So, Nurse Piggott, you face that worry in the COVID-19 unit, but we've heard also that nurses face challenges outside of here, transportation, getting into supermarkets and so on. Have your nurses told you about that?
Yes, so I've heard stories of nurses, one, getting difficulty in getting transportation in terms of getting here, especially if they're well known in their village where they're living. If the driver knows that, yes, this is a nurse, even if they try to change their uniform to come out casually, yes, it's a stigma being attached to not just the nurses, but the doctors, as well as the auxiliary staff, which will make up definitely the cleaners and so forth. That's still working every single day for us. For me, I had personal experience with it. Yes, I do have my own transportation, so it eases me a bit with that. But I did try going to the supermarket after I finished working here a day because I had to get stuff for my home. And yes, in going to that supermarket, the workers there, they stigmatized me in terms of one, the way in which they were looking at me, and I did not feel comfortable. And I did bring it up with them, that I don't think it should be an issue.
Does that make you sad?
In that moment, at least prior to that, I just heard stories of it happening. But then with it actually happening to me, it made me feel different and it made me feel away. Because that was the first time I went to that specific supermarket with actual work clothes. Prior to that, I always go with casual or something. And for me, it was like, okay, when it's unknown, you don't have an issue. But because today is an emergency and I ran out with my uniform, why is it that you're stigmatizing against me. So I did feel away that day.
So if there was something you were to say to people in the public, especially people providing that service, what would you say to them?
So for me right now, all I would ask John Public right now to do, right? Everybody have their role to play in society. At this point in time, with this pandemic hitting us, our nurses, our doctors, the cleaners and so forth, they have their part to play. One, we should be thankful that these persons are putting their lives at risk and they're coming out, they're literally leaving their homes. And mind you, they don't have to. But like I said, we all took an oath and we're actually living up to that oath right now. And something that I'm actually proud of for our medical staff and auxiliary staff is that our absenteeism rate is very, very low. It was expected for it to be high, but it's nice that our staff, knowing that how deadly this pandemic is, and they're actually stepping up, and they're coming out, and they're working. And they're not working because their mothers or their fathers, they're in the hospital. They're coming because there's a stranger lying on a bed that needs care. So I'm very highly appreciative of that, and I would like to ask John Public if in any way you could help a nurse. If you know you have a neighbor as a nurse, and you could come out in the night, maybe at 7 o'clock when a nurse needs to come out, you could take the necessary precautions necessary. You could wipe your car, you could Lysol your car, whatever you need to do. Even if you want to put a bit of plastic as a protection, there's nothing wrong with that. But do not discriminate against that person. Try to help them as much as possible, because it's unfair for nurses to be walking from the park right now to come to work. What if something happens to that nurse? Who's going to take care of the patient here? We need to take all these things into consideration. Or are we going to wait until our relative comes on that bed and then we're going to beg that same nurse, please, or that doctor, plead with them to actually assist us then? No, it shouldn't be that way.